My name is Devon Danner-Allison. I am a student at Western. I am actually a second-time student at Western. The first time I actually got my bachelor's degree of nursing. One of the reasons why I decided to come back to learn Spanish was so that I could actually converse with my patient one-on-one. Here in Western North Carolina, we actually have a fairly big Hispanic population. People that come from Mexico, Honduras, El Salvador, all kinds of other countries. Because of that, there's actually a great need in the hospital system for people that speak Spanish. Right now at the hospital I work at in Haywood County, we only have an interpreter phone. I actually work in labor and delivery, so we have a lot of Hispanic moms and dads that come in and they don't necessarily know how to speak English very well. Right now, the only thing we can do is use the interpreter phone at night because we don't have a dedicated person that can translate for us. So one of the things that we've been learning about in class recently, I'm taking the intermediate Spanish at this point. Their grammar structure is much different from English. So instead of saying like, my knee hurts in Spanish, the direct translation was, the knee hurts me. English and Spanish are totally different in their grammar structure. It also kind of helps to review your English grammar because you want to say something one way, but it's not the correct way. My advice for anybody that has the potential for their career to work with Spanish-speaking clients is to brush up on a little bit of Spanish. Even just a little bit will help. I know one situation we ran into at the hospital was our phones were actually out completely at the hospital. This was actually before I started taking Spanish classes, but my coworker and I were able to muddle through a little bit of Spanglish. They actually do offer medical Spanish classes for nurses and healthcare practitioners. I know Mayheck and Asheville offers one every once in a while. Another thing I recommend too is to just kind of get you a little phrase book, kind of like, how are you, and ask basic questions. That way, if you ever do run into that kind of situation where you have somebody that doesn't speak English, that you have that